Bismillahirrahmanirrahim. After we studied tumors of the skin, now we're gonna discuss soft tissue tumors. What is soft tissue tumors? Are tumors that arises from the mesenchymal cells. They include all mesenchymal tumors other than bone and cartilage. The bone and cartilage are discussed separately in a separate chapter. Now, it is discovered that these soft tissue tumors arising from pluripotent mesenchymal cells and then differentiate towards the mature mesenchymal cells, not originating from the mature mesenchymal cells. So, every soft tissue tumor arising from undifferentiated mesenchymal cells or pluripotent mesenchymal cells. Then it may differentiate towards production of fat, so it is called, if in case of malignant tumor, a liposarcoma. If we're talking about fibroblast, so it is fibrosarcoma. Muscles, leiomyosarcoma, smooth muscles, leiomyosarcoma, skeletal muscles, rhabdomyosarcoma. So all of these soft tissue tumors arising from undifferentiated cells. And according to what we have studied before in general pathology, the differentiation of mesenchymal tumors depend upon the cell product, what the cell will produce when it is mature. Okay, lipid cells produce fat, or the lipoblast and lipocytes produce fat. The fibroblast produce collagen. The smooth muscle fibers, the smooth muscle cells produce smooth muscle fibers. Okay, so the soft tissue tumors arising from undifferentiated cells or pluripotent mesenchymal cells, then it differentiate towards a specific cell product it produces. Okay, so we have undifferentiated sarcoma arising from the mesenchymal cells and no giving specific production. Okay, benign soft tissue tumors are much more common than the malignant ones, thanks God. Okay, regarding tumors of the adipose tissue, the benign counterpart is called lipoma. The malignant counterpart is called liposarcoma. Tumors of fibrous tissue, the benign is called fibroma. And fibromatosis, we will discuss it in detail later. Then the malignant counterpart is fibrosarcoma. Regarding the fibrohistiocytic tumors, the benign counterpart is benign fibrous histiocytoma, tumor arising from the fibroblast and histiocytes. So it is called benign fibrous histiocytoma. And the malignant counterpart is malignant fibrous histiocytoma. It was called before undifferentiated pleomorphic sarcoma. Okay, it was not known really from which cell it arises or from which cell it differentiates to. Dermatofibrosarcoma protuberans, it is a locally aggressive tumor. We have studied a locally aggressive tumor two lectures before, which is basal cell carcinoma. Basal cell carcinoma, the dermatofibrosarcoma protuberans are both locally malignant tumor or locally aggressive tumor or tumors of intermediate malignant potential. Tumors of skeletal muscles, the benign counterpart is rhabdomyoma. Okay, the malignant counterpart is called rhabdomyosarcoma. So the sarcoma, okay, refers to malignant tumor of mesenchymal cells, and then add to it the cell towards the cells of differentiation. Towards it differentiates. Tumors of smooth muscles, leiomyoma, the benign counterpart, and leiomyosarcoma, the malignant counterpart. And vascular tumors, the benign counterpart, hemangioma, okay, containing blood, benign tumor containing blood. and lymphangioma, benign tumor arising from the vascular endothelium and containing lymph. Okay, hemangioendothelioma is also a locally aggressive tumor. Okay, it is a locally aggressive tumor. Angiosarcoma, which is the malignant counterpart. Tumors of the peripheral nerve sheath, like the benign counterpart, like schwannoma and neurofibroma, and the malignant counterpart is malignant peripheral nerve sheath tumor. And finally, tumors of uncertain histogenesis. We do not know what is the specific cell toward it, it differentiate, the tumor differentiate, which is synovial sarcoma. Okay. Now we will start each type of tumors in the soft tissue according to this classification. Starting by tumors of the adipose tissue, the benign counterpart, which is lipoma. Lipoma is a benign tumor of adipose tissue, as we said. It is the most common soft tissue tumor. Where it arises? It arises from every site that containing fat or lipoblast. Okay, like what? Like the subcutaneous tissue. The skin is formed, which we are concerned with it here. The skin is formed of epidermis, dermis, and subcutaneous tissue. So subcutaneous tissue all over our skin may arise from it lipoma. Okay, but it may arise from any other place which containing fat, like what? Like between the muscles, intermuscular septi, in the breast, in the buttocks, in the omentum, which is holding the viscera together. Okay, in any site except CNS, as the CNS do not contain fat cells. Okay, so the lipoma occurring in any site in the body, the most common, of course, is the subcutaneous tissue of our skin. It may occur in any region between the muscles, omentum, breast, whatever organ, except the CNS. Okay, clinically, what can we see in a case of lipoma? The patient is complaining of mass, slowly growing mass, mobile and painless mass. Okay, slowly growing. It is a benign proliferation of cells differentiating towards the fat. Okay, so it is a slowly growing mass, mobile mass, freely mobile mass, and painless. Okay, what we can see grossly, lipoma is a tumor arising, tumor differentiating towards the adipose tissue. So the benign tumor, so it is looks like its origin. Okay, looks like its differentiation. What is the fat looks like? The fat, its color is yellowish. So the lipoma is yellowish in color. The fat is soft in consistency. So the lipoma is soft in consistency. The fat is greasy. So the lipoma is greasy. Fat is lobulated, divided into compartments. So lipoma is lobulated. So grossly and microscopically, it looks like the cell towards which it differentiates. Okay, so lipoma is differentiating towards adipose tissue or fat, so it looks like fat, both grossly and microscopically. Grossly, it is a well-defined capsulated tumor. As we know from general pathology, most of the mesenchymal tumors are capsulated, okay? Except, or all mesenchymal tumors are capsulated except myoma, angioma, osteoma. Okay, all mesenchymal tumors are capsulated when we write it in our description, but except for myoma, angioma, osteoma, they are not capsulated. Okay, do you think this tumor, this benign tumor, is well defined or ill-defined. It is a benign tumor, so it is well-defined capsulated tumor. Soft like its origin and greasy like its origin, like the fat, بيزحلق, and lobulated. Here is the pictures of lipoma, well circumscribed masses, lobulated masses, lobulated here. Here is the lobulation, okay, and yellowish in color and soft in consistency. If we hold it between our hands, it is soft. Okay, soft in consistency, soft like lobule of the ear. Okay, soft in consistency, yellowish in color, and greasy. Okay, and capsulated. We cannot see it here, but it is surrounded by very thin fibrous tissue capsule. Regarding microscopic picture, it looks like the normal fat cells, but proliferated. Okay, it is a benign tumor, well circumscribed tumor covered by capsule, so it is formed of fibrous capsule. Okay, fibrous capsule from which delicate vascularized connective tissue septi dividing the tumor into lobules. These lobules are formed of mature fat cells. All of you know the mature fat cells from histology. They are cells filled with fat, and during preparation it disappears, so it leaves an empty space. Okay, and pushing the nucleus at a side, we cannot see it here. Okay, like a signet ring. Here is the pictures. Here is microscopic pictures of lipoma. Here is mature fat cells. Here is mature fat cells, and this is the fibrous septi. Here is the fibrous septi. Another one here. Here is the outside, our outer capsule here, and underlying it there is lobules of mature fat cells. The fat lobules or fat globules disappeared during or dissolved during preparation of our slides. Okay. Regarding the malignant counterpart of tumors of the adipose tissue, we will talk about liposarcoma. Liposarcoma is a malignant tumor of the adipose tissue. It occurs in old age group, relatively from the 5th to 6th decades. Okay, in the 50s or 60s. They arise in the deep soft tissue. Okay, in the deep soft tissue or the retroperitoneum, not superficially as in cases of lipoma. It is deeper. It is a deeper tumor. It is relatively a well circumscribed mass. It is a sarcoma, malignant tumor, but it is well circumscribed with glistening yellowish cut section. It differentiates towards lipoblast, not lipocyte, as in cases of lipoma. Lipoma under the microscope, we can see mature fat cells or lipocytes. But here in liposarcoma, we have to search for the lipoblast to call it liposarcoma. So the presence of lipoblast, we call it liposarcoma. Here is a gross picture of liposarcoma. It is fairly or well circumscribed mass with a yellowish, a little bit yellowish cut section. This liposarcoma is variable in their degree of differentiation. Okay, we have to search for the lipoblast to call it liposarcoma. Lipocytes is present in cases of lipoma. So in a case of lipoma, we have to search carefully for a lipoblast in order to be called well-differentiated liposarcoma, not a lipoma. So presence of lipoblast, we call the tumor liposarcoma, lipoblast, not lipocyte. Okay. They have different histopathological subtypes with variable prognoses. Okay. Regarding tumors of the fibrous tissue and tumor-like lesions of the fibrous tissue. Firstly, we will talk about fibroma. Fibroma is uncommon benign tumor of fibrous tissue. Fibrous tissue, so fibroma may occur in it. It is most commonly occurring in the skin or any parenchymatous organ, the connective tissue stroma of the parenchymatous organ, like ovary, like GIT. Grossly, what we can see? Grossly, it is capsulated, firm mass, okay, with whorled grayish-white cut section. Fibroma, okay, differentiating towards fibrous tissue and collagen. So the cut section of it is firm, looks like its origin or its differentiation. So the cut section is firm, and its color looks like the color of the fibrous tissue, which is grayish white. So fibroma is well circumscribed, firm, grayish white mass, and it is capsulated. As we said, all mesenchymal tumors are capsulated except myoma, angioma, and osteoma. Okay, here is a gross picture of fibroma. It is a well circumscribed mass, capsulated. It is very thin fibrous tissue capsule, and the cut section is homogeneous, whorly cut section with grayish-white discoloration. Okay. Microscopically, what we can see? It is a benign proliferation or benign tumor of fibrous tissue. So it is formed of proliferated mesenchymal cells differentiating towards fibroblast or proliferated fibroblast with a collagenous stroma. The product is collagen. So it is proliferated fibroblast in a collagenous stroma. And secondary changes are common, like what we have studied in general pathology, like hyalinosis, which does not appear grossly. It is a microscopic description only, and calcification. Now we will move to another entity, which is fibromatosis. Fibromatosis is a benign fibroblastic proliferation, or tumor-like lesion. Okay. The cells are cytologically benign, but this lesion is characterized by local infiltrative growth pattern. Infiltrate to the surrounding tissue, but never ever metastasize. Okay, no metastasis at all. So surgeons should keep this in mind because it has infiltrative growth pattern. So when they excise this lesion, they have to do wide safety margin, because this tumor or this lesion is likely to recur in cases of improper surgical excision. So wide safety margin is recommended in these cases. Okay. Types of fibromatosis. Fibromatosis is divided into two types according to the site of occurrence. It may be superficial fibromatosis or deep fibromatosis. Regarding deep fibromatosis, it is subdivided into abdominal desmoid tumor occurring mainly in females. Okay, in postpartum cases following cesarean section. Okay, following cesarean section or any abdominal surgery. It occurs in the muscle fibers, in the fibrous tissue septi between the rectus abdominis muscle. Okay, it occurs in the rectus abdominis muscle. Okay, So this is the first type, which is abdominal desmoid. The abdominal desmoid occurring mainly in females following cesarean section or following any abdominal surgery. It occurs in rectus abdominis muscle. Second type is extra-abdominal desmoid. Extra-abdominal desmoid. It arises from the shoulder muscles or the pelvic girdle muscles between the fibrous septi and the shoulder girdle muscles or the pelvic girdle muscles. Okay. The third type is intra-abdominal. Intra-abdominal retroperitoneal fibromatosis. So, fibromatosis is a benign fibroblastic proliferation characterized by local infiltrative growth pattern. Local infiltrative growth pattern, and the surgeons should keep this in mind because he should do wide surgical excision. Wide surgical excision with wide safety margin, because its ability to recur. Okay, three types of deep fibromatosis: abdominal desmoid arising from rectus abdominis muscle, and extra-abdominal desmoid arising from the shoulder or pelvic girdle muscles, and intra-abdominal desmoid as in cases of retroperitoneal fibromatosis. Regarding the superficial fibromatosis, superficial fibromatosis is subdivided also according to the site of occurrence. First, first type is palmar fibromatosis. Palmar fibromatosis. From its name, palmar fibromatosis, so it appears in the palmar fascia. It appears in the palmar fascia. This is fibrous tissue. The fibrous tissue is characterized by contracture and deformity. So it causes contraction and deformity, especially in the ring finger and the little finger. The ring finger and the little finger. Here is palmar fibromatosis and causes contraction of the little finger and the ring finger. Okay, this is the first type, which is palmar fibromatosis. The second type, which is plantar fibromatosis. Plantar fibromatosis, from its name, so it appears on the plantar surface or the sole of the foot. Okay, here is plantar fibromatosis. The third type, which is penile fibromatosis. Penile fibromatosis occurs on the surface of the penis. Occurs on the surface of the penis. And this is another picture of the fibromatosis inside the muscle or desmoid tumor. Here is the muscle fibers. The dark brown here is the muscle fibers, and the grayish white here with infiltrative growth pattern infiltrate the surrounding muscle here is fibromatosis. So can you see here the white safety margin here? But this is close. Here, this margin is closed, but this is a wide safety margin here. Okay, wide safety margin because of liability to recurrence due to infiltrative growth pattern. Okay, and this is a microscopic picture of fibromatosis. You can see here the spindle cells, the fibroplastic proliferation here. Okay, forming whorls or fascicles. And here we can assess here infiltration through the muscle and infiltration through the fat. Okay, here is the fibrous tissue, the spindle cells here, fibrous tissue. Okay, and this is fibrous tissue is dividing here the muscle fibers, and also this is the fibromatosis. Okay, this is spindle cells, the bland-looking spindle cells or fibroblast. Okay, and this fibrous tissue is spreading or having an infiltrative growth pattern, splitting the muscle fibers here. Here's the muscle, and this is the muscle, and the fibromatosis is splitting the muscle fibers. Okay, splitting the muscle fibers. Regarding fibrosarcoma, fibrosarcoma are malignant tumors composed mainly of fibroblast. It is a malignant tumor of fibrous tissue, and it is composed of fibroblast or cells differentiating to be a fibroblast. It occurs mostly in adult patients occurs where? In deep tissues of the thigh and the retroperitoneal areas. Fibrosarcomas grows very slowly and it is a malignant tumor, so it infiltrates the surrounding and it may recur and it can metastasize to other organs by blood, like any sarcoma. Okay, gross picture, it is encapsulated mass, fleshy mass, maybe circumscribed, like liposarcoma only, it may be circumscribed. Okay, so fibrosarcoma is encapsulated mass or uncapsulated mass, fleshy mass, may be circumscribed. Here is a picture of fibrosarcoma here. This mass is fairly circumscribed and infiltrate here this area, infiltrate here the surrounding tissue. Okay, here is also infiltration of the muscles here. Here is microscopic picture. Fibrosarcoma is a mesenchymal tumor differentiating towards fibroblast. So, in well-differentiated tumors, it is formed of malignant spindle-shaped cells or malignant fibroblast arranged in fascicles with herringbone arrangement. What is herringbone arrangement? Here is the herringbone. Okay, some group of cells arranged longitudinally and others arranged transversely upon it. Okay, here is a microscopic picture of fibrosarcoma. Spindle cells with all the criteria of malignancy, like pleomorphism, hyperchromasia, increased nucleocytoplasmic ratio, mitosis, increased mitosis, abnormal mitosis, arranged in fascicles, okay, with this herringbone appearance. Okay, some groups of cells arranged longitudinally and some are arranged transversely. In less differentiated tumors or poorly differentiated tumors, the cells are much more pleomorphic cells with more frequent mitosis and wide areas of necrosis. Okay, here is the well-differentiated fibrosarcoma, and this is the less differentiated or poorly differentiated fibrosarcoma. We can notice here the frequent mitosis here. Regarding fibrohistiocytic tumors, fibrohistiocytic tumors from its name. They are divided into benign fibrous histiocytoma and malignant fibrous histiocytoma, and in between there is intermediate or locally malignant tumor, which is dermatofibrosarcoma protuberans. Benign fibrous histiocytoma, it occurs mainly in the skin. It is called the dermatofibroma. So benign fibrous histiocytoma occurring in the skin is a well circumscribed and firm mass present in the skin mainly, and it's called dermatofibroma. And the malignant counterpart, which is malignant fibrous histiocytoma, it is a group of pleomorphic both fibroblast or myofibroblast and histiocytes. Okay, it's forming a storiform or cartwheel pattern. This is the cartwheel pattern. The cartwheel pattern. The cells are arranged in cartwheel pattern with many giant cells. So we have different patterns. In fibrosarcoma, we show the herringbone appearance. In fibrohistiocytic tumors or malignant fibrous histiocytoma, we see the cartwheel appearance of both the malignant pleomorphic spindle cells and the histiocytes here, with many giant cells. Okay, this picture showing many giant cells, multinucleated giant cells, histiocytes, but fused together, forming giant cells. And in between these two categories, the benign fibrous histiocytoma and the malignant fibrous histiocytoma, lying another category, which is dermatofibrosarcoma protuberans, also occurring in the skin as in benign fibrous histiocytoma, but it is locally invasive to the surrounding. It lies in the group of intermediate or intermediate group, or tumors of intermediate malignancy or intermediate malignant potential. Okay, now we finished our lecture today. Now we finished our lecture today, and we will discuss the rest of soft tissue tumors in